A very good morning to you. How are you doing? Karibuni sana. I'm very excited and blessed to be here on the 23rd of October 2024. Time is really running, but we do thank the Lord for yet another amazing time to be here. It means that the Lord has been so good to us. The fact that you're alive, it means that God has a plan for you today. All right, so today being a Wednesday, inakwanga ni ile siku ya Afya Clinic when we talk about everything health. Okay, and today we're going to be having such an intense conversation because we are focusing on what this month has been focusing about. But before we get there, tutakuwa tunaanza na some of the health updates just for you to know what exactly has been happening in the past 1 week from the last time we were here on Wednesday. Ni nini imekuwa ikifanyika in the health world. All right, so that is what we're going to be looking at, and then we'll be getting the in history. Our SMS code 23814, absolutely free of charge. And then of course we're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and you can always get me on all social media platforms at Rachel Kahugo. And of course on Instagram and Facebook ukitafuta tu pale Kahugo utanipata, and there's a Roger says.
We are advancing the scope of the universal health coverage to give every Kenyan access to promotive, preventive, curative, and emergency services. Through the Social Health Insurance Fund, citizens will contribute and access comprehensive healthcare benefits. And those who are categorized, the value for money in this scheme will be undeniable once the migration from the National Health Insurance Fund is completed and the fund is fully operational. As of the beginning of this month, 12.9 million Kenyans were registered with the Social Health Authority, and all public health institutions and alongside 50% of private facilities were already enrolled to provide services. I urge private hospitals to expedite the contracting process to enable us complete the final rollout of the universal health coverage. To accelerate this rollout, the government of Kenya has released 3 billion shillings to settle outstanding payments to hospitals and other service providers.
And on our second news item today is that there was a training workshop to boost public health emergency response. The division of the Port Health Services, in collaboration with the World Health Organization (WHO) and the International Organization for Migration (IOM), conducted a training workshop at Jomo Kenyatta International Airport from October 14th to October 18th. The workshop aimed at enhancing the skills of port health officers from various airports, ports and ground crossing in preventing and responding to public health emergencies. Participants focused on the application of international health regulations IHR 2005 to control the international spread of diseases while supporting safe travels and trade. Dr. Diallo, WHO representative, reiterated the global body's commitment to supporting the Ministry of Health in strengthening workforce development in Kenya. He highlighted the need for implementing the requisite IHR core capacities to points of entry to enhance the country's readiness for epidemic or pandemic-prone diseases and other public health events. This training underscores Kenyans' dedication to enhancing public health safety and effective emergency response. So that is what we get today on the health update. But of course, for more news and to know everything that is happening in Kenya and beyond, your comments, and we will be getting them. But for now, let's get to know the history of breast cancer.
The journey of breast cancer awareness and care in Kenya. Breast cancer, a disease that has impacted countless lives around the world. In Kenya, the story is one of resilience, awareness, and evolving medical care. For many years, breast cancer was shrouded in cultural stigma and misunderstanding. Women often suffered in silence, with their ailments misunderstood and attributed to various societal issues. But change began to emerge in the late 20th century. Advocacy groups like the Kenya Cancer Network started to break the silence, educating communities about breast cancer. Today, breast cancer is the most common cancer among women in Kenya, with approximately 7,000 new cases diagnosed each year. It also claims about 3,000 lives annually, making it the leading cause of cancer-related deaths among women in the country. Despite these alarming numbers, early detection remains a challenge. Less than 30% of Kenyan women have ever undergone a breast cancer screening. In urban areas, awareness is improving, with about 70% of women
105 and we will surely make your day memorable.
Happy birthday!
Happy turnings! Get ready for non-stop adventures and lots of fun! Each episode is packed with engaging stories, vibrant animations, catchy songs, educational session, and unforgettable moments.
She sells seashells at the seashore. Hey!
We inspire and empower young minds as we develop important life skills while having a blast. Join us every Saturday on your favorite channel from 9:30 a.m. as we have an amazing time. Don't miss out! Experience a journey of spiritual elevation and immerse yourself in the most uplifting worship moments. Watch the best of worship culmination every Saturday from 3 p.m. to 5:30 p.m. It's an awe-inspiring event featuring anointed worshippers and going beyond the studio to connect with young souls eager to embrace the divine presence in educational institutions. Get ready to elevate your spirit and embrace the true essence of worship with Maria Omondi and her incredible team of worshippers.
In a world filled with secrets, betrayals, and unexpected twists, two sisters are about to collide in ways they never imagined, lighting a fire that will shake their lives to the core. And now, there's the old cycle of pain and betrayal. Yet, a new challenge is at hand. Join Hadassah on a journey of redeeming her destiny every Sunday at 7:30 p.m.
Marriage is not a mark of completeness, nor is singlehood a mark of incompleteness. Most people look forward to married life, but when is the right time to start a relationship?
The two shall become one, isn't it? Therefore, was. That is what we call an affirmative covenant. Are we showing fidelity?
Don't miss the marriage classroom to learn more about relationships and marriage.
Relations in a relationship that is not yet joined together, you are not in marriage, is a no. It will never be right now, it will never be right tomorrow. It will never be okay, even in the future.
Every Sunday.
But that's just the beginning. Dr. Dulcie is a passionate cancer advocate, tirelessly educating the public and raising awareness about crucial cancer initiatives. Through her dynamic media presence and collaborations with the government and organizations, she is breaking down barriers, essential resources like testing, chemotherapy, and radiotherapy. Moreover, as a skilled Kenyan Sign Language interpreter, Dr. Dulcie champions the inclusion of deaf and hard of hearing patients, ensuring they receive the comprehensive care they deserve because every patient matters. With a rich background that includes vital roles at the Kenyatta National Hospital and Nakuru Provincial General Hospital, Dr. Dulcie brings years of experience, years of expertise, and a deep commitment to her community. Get ready to be inspired. Join us as we explore the incredible journey of Dr. Wanda Dulcie.
Who Dr. Wanda is, and she is already here with us. So, again, I repeat, that if you have any question regarding breast cancer, this is the day for you to get clearance on the same. And we'll be looking at some of the mythbusters as well, kwa sababu here, we realize that we have a lot of myths surrounding breast cancer, so we'll be looking at that. But karibu sana.
Thank you very much.
We are very glad to have you today.
I'm happy to be
here.
Yes.
So please say hi to our viewers and then you can
Good
start.
morning. I'm happy you joined us. Hope you'll stay through the show so that we can learn more about breast cancer.
Yeah. So for a start, what exactly is breast cancer?
So when we talk about cancer, we're talking about a group of cells that are not behaving normally.
Okay.
In the body, the whole body is a collection of cells. So normal cells are supposed to grow, divide, and eventually die off. But we have an error in that process of growth, division, and dying off, such that you have a group of cells that are growing uncontrollably, that are not dying off, that have capabilities to avoid the immune system, ability to make their own blood supply, such that it's a colony of cells that is focusing on its survival at the expense of the body. So that's what cancer basically is. They do not have a lot of breast tissue. Then it means it's more aggressive in men. For women, we have space, so the tumor has a place for it to grow within the breast. For men, it's very easy for it to go to the ring, suspicious that need urgent attention.
Okay.
Yes.
Wow. So if you're below the age of 40, don't feel too comfortable, go get checked. Go get checked.
Yes.
So at what stage do you start feeling some alarm or some pain?
Okay.
At what stage of cancer?
So most of the time, if you have pain, most probably it's advanced. It has gone to a nerve, or it's very close to a nerve and it's causing irritation, or there is pain because it's compressing some of the structures. Remember, you can feel pain if a nerve is irritated. You can feel pain if there is a compression, something is pressing on you. That can happen. So it's important for us to know some of the signs to look out for. I always say you need to know what is your normal. If you know your feet, you know one. It's good to have a mirror that you can be able to see your breasts. It's important for you to do certain movements to see how the breasts move, like put your hands on your waist, put your hands behind your head, just to see how, because the breasts are on top of a muscle. So as you move your hands, then you can see how they move. And if you notice one is not moving, if you notice one is larger than the other, you notice like there's a mass. The skin has changes, like it has become like a tangerine. If you look at a tangerine, it has dots on it. We call that peau d'orange in French. It's a word we use in medicine. So if it looks like a tangerine with small dots in your breast, we need to check it out. If the nipples are retracted, normally the nipples need to stand out. But if one is retracted, there's something pulling it in. Chances are there could be a tumor that is causing that. If around the nipple there is crusting, drying, peeling of the skin, it could be what we call Paget's disease, and which could be an indication of cancer within the breast that needs to be examined. So what we're saying, know what is your normal. Go for screening. Make sure you're having a medical personnel examine your breast. Above the age 40, let's do a mammogram so that we can catch this disease very early, because the earlier we catch it, the better the outcomes we see.
You know what I'm getting from the discussion, which most of the people really aren't very keen on, is that if you see any change, you need to go get checked. Because most of the times people will be like, in kitu kidogo, until I have some pain, don't tenda hospitalini. But until you have the pain, to like, this is something normal. And most of the time, I've had this discussion, Sana, that are probably hormonal imbalance to itakuwa sawa with time. So if you see any little change, please go to hospital. And does that apply for men as well?
Yes, it does. And it's very important for them to come early because, like I mentioned, there's no much tissue. So any mass that is there, it's easy for it to enter the ribs and the lung, meaning become stage 4 disease, easier than for women because of the size or the space in which it can remain within the breast. Something else to mention that people don't think about, we have patients with diagnosed breast cancer in pregnancy. So it does not mean if you're pregnant, you cannot get breast cancer. Others have been diagnosed with breast cancer during breastfeeding. So a mass in your breast during pregnancy, we do not ignore it and say, just go ahead and finish giving birth, we'll think about it later. Because we are able to treat breast cancer even during pregnancy. After the first trimester, then we are able to give even chemotherapy during pregnancy. Because if we were to wait out the whole 9 months, then we're giving the disease a chance to really metastasize, go to different organs, become stage 4. So we start treatment early if we know it is cancer. So let's not ignore breast changes or a mass during pregnancy or even during breastfeeding.
Wow. Okay, it was very, very important to mention. Yeah. And now because we're there, let's get to take a look at some of the other myths that people have. So let's get the Mythbusters. I know this topic, breast cancer, it has had a lot of misconceptions, and especially the part where people say that, this is just for ladies, this is not for men. And it was very important for you to make that clear, that even for men, if there's any change, it's very important for you to go get checked. The earlier, the better. Yes. All right, let's get them Mythbusters. Okay. All right, sawa. From our mwelekezi, we'll be getting them a bit later, so that works well. But, naona kuna mtu anauliza, how accurate is
an MRI?
Okay.
Just to confirm if the findings are inconsistent. For example, I've not felt anything, but the ultrasound sees something very big, then I want to confirm it with an MRI. So we use investigations to complement the history, to complement the physical examination, just so that we have a complete picture of what we're seeing.
Okay. Yes. And breast cancer, is it hereditary?
That's a good question. I think most people say, in my family there is no breast cancer, so I'm good. That's a myth.
Okay.
Because it's only 5 to 10% of breast cancer that is hereditary.
Okay.
We have a 90% that is just nobody in your family has breast cancer. You become the first person to have that error in the division of the cells, and that cancer happens in you, in breast cancer. So there's just a 5 to 10% chance of it to be hereditary, but 90% of breast cancer, there is no family history.
Okay. So what's the cause? What's the cause for the breast cancer to just come up?
All right. So that's a good question, and I think most patients, even when they are diagnosed, they ask Daktari, how did it come about? How did I get this? So one, it's multifactorial.
Okay.
We cannot say one reason. You did this, and this is why you got breast cancer. But remember, there are certain risk factors that are just being female. You have a higher risk than the men. Secondly, the hormonal component. So if you start your menses early, we're talking about before the age of 12, and you get your menopause after the age of 60, that means you've had a long duration of having hormones in your system. That's a risk factor.
Okay.
Our lifestyles can be implicated. So if women have a habit of cigarette smoking, alcohol use, it's a risk factor to getting breast cancer. If I have cancer, can recur.
Okay.
So that is a challenge. If the error is in your DNA, then it means even as we treat, there are other changes that are happening in the cells, and the cancer can actually not respond to our treatment. Do we have patients who've been treated and are cancer-free for more than 10 years? Yes. Do we have those whose cancer has never recurred? Yes. So that's just to say there's a spectrum of the response. And there's certain cancer strains, or I wouldn't call it a strain, but cancer is not one disease. Breast cancer is not one disease. I think that's important to note. 10 women with breast cancer, you might find them on totally different treatment regimes, because it's not one disease. It's not the way you say malaria, and we know there's a formula just to treat it and a protocol that works for everyone. It's different for breast cancer, because we look at the type of breast cancer, we look at the grade, is it aggressive, is it not aggressive, we look at the hormonal component, does it respond to hormones or not. So we know that there are certain types of breast cancer that are more aggressive than others. For example, triple negative breast cancer is more aggressive, there are higher chances of recurrence, and such patients, we put them on more surveillance. Their treatment regime is a bit different. For those who they have hormonal component, then we put them on treatment to suppress the hormones up to 10 years, even after the treatment. So they take a tablet a day for 10 years, just to keep the hormones on the low down, to reduce the chances of the disease coming up.
So then after 10 years?
After 10 years, we've suppressed it enough. And research has shown that should be enough to keep the disease at bay. And the